When you get your tonsils and adenoids out, this is a procedure that takes about 30 minutes to do. I typically come find the family right after, and so stay around or at least give us your number so we can reach you. When you get your tonsils and adenoids out, there are several good things to know to help, and there are several things to avoid. I have several concerns when you get your tonsils out. First is bleeding. Some people bleed when they get their tonsils out. You would know because you would spit up blood, and it's not a little bit of blood mixed with saliva. It's big clots, big chunks of blood. Children, if they swallow the blood, will actually vomit it, and so it will look like a lot of blood because they'll vomit up their stomach contents with it. If somebody does bleed, bring them to the emergency room. Most bleeding just stops on its own, but sometimes it doesn't, and we have to stop it. So if they bleed, bring them in. The sneaky thing about bleeding is it happens about 1 week after surgery. Sometimes between 5 and 10 days after surgery is usually the time that you're going to see bleeding. It can happen also in the middle of the night. And so for small children, I always recommend that the parents keep the child close to them or in a place where they can hear them at nighttime. The second major concern I have besides bleeding is the use of narcotics. Narcotics are helpful because they reduce pain. However, narcotics are very dangerous. They reduce your desire to breathe, and if you take too much of it, it can actually stop breathing and result in death. When you get your tonsils out, you're going to need narcotics. Most people do, but you want to use them very carefully and very judiciously. You want to use the least amount possible to get your benefit. You can always give the full dose if you think somebody needs it, but always give the lower dose. Don't give narcotics in the middle of the night. You have to think of narcotics like alcohol. You would not have somebody who's very drunk wake them up and then pour alcohol in their throat and have them go back to sleep. That would be very dangerous, and narcotics are the exact same way. Do not give narcotics in the middle of the night when somebody's going right to bed. Always have it in a situation where you can assess their mental status to make sure that they're not overly sedated. So look out for bleeding. It's okay to take narcotics, but you need to be careful about that. Using medications like ibuprofen and Tylenol are totally fine in tonsillectomy and actually encouraged. Ibuprofen can reduce the amount of narcotic use, and so we like using it. Tylenol is found in the narcotic, so you cannot use Tylenol with the narcotic, but you can use Tylenol and ibuprofen around the clock, especially in children. Just give those every 6 hours, and if you stagger them, you're giving one every 3 hours. So Tylenol, ibuprofen, and then insert the narcotic instead of the Tylenol when you think it's appropriate. So bleeding's bad. The narcotics you have to be careful with. Things that are good for getting your tonsils out, soft cold things like popsicles are really helpful. You can eat whatever you want, but using soft cold things helps soothe your throat. So soft cold things are helpful. Using humidifiers helps. The more moist your throat is, the better it feels. So that's really helpful. You're going to have several medications. You'll have the pain medicines. You should have received numbing suckers from the compounding pharmacy. This is something that you can use. Take a couple of licks of it until it has its effect, and then put it in the refrigerator so you can reuse it again. So you'll have pain medicine, numbing suckers, nausea medicine in case a pain medicine makes you nauseated, and that's usually it. Most patients don't require antibiotics. It's normal to run low-grade fevers after tonsillectomy to 100, even up to 101, and that can be expected. If your fever goes to 102, then you need to tell us. I usually don't need to see people after tonsillectomy unless there's been a problem. If you have any concerns or questions, always feel free to call us, and always come into the emergency room if you have any questions about dehydration, fevers, too sedated from narcotics, bleeding, and they can absolutely help you.